All right, the last section that we're going to cover in this chapter is going to be cardiovascular disorders. All right, there are a lot of different cardiovascular disorders. This is going to be the leading cause of death or early death in Western countries. And a lot of times, the cardiovascular disorders that we're going to be discussing are disorders of the blood vessels. So, for example, hypertension. Hypertension is another term for high blood pressure. This is when you have a systolic pressure of 140 or greater, or a diastolic pressure of 90 or greater. This is the silent killer because there are very few symptoms until it causes kidney failure, heart attack, or stroke. This can be treated with diuretics, which will increase the production of urine and help lower that high blood pressure, help funnel some of that fluid out of your cardiovascular system. There's also atherosclerosis. This is the buildup of atherosclerotic plaques inside of the walls of the blood vessels. The plaques will help narrow those blood vessel diameter, and this will decrease the blood supply to the tissues ultimately. Now, the unfortunate part of this is that it can also cause clots to form in the roughened walls of the arteries. And there are a couple of different terms for clots. So things like a thrombus. This is a clot that is stationary. An embolus is a clot that detaches and moves to various sites. Thromboembolism is an embolus that has become lodged in a blood vessel. This can, of course, cause a lot of different issues to occur. Heart attack might occur. I'm so sorry. One more. This could cause a couple of different incidences, like a myocardial infarction, which is a heart attack. This is where part of the heart actually dies due to lack of oxygen. It's typically blocked. It's caused by a block of a coronary artery. It can begin with angina pectoris, which is just means pain in the chest from a partially blocked coronary artery. But if it becomes fully blocked, it can lead to actual death of that heart muscle tissue. It can be treated with drugs that will dilate those blood vessels to make it easier for those clots to pass, but it still is a very dangerous situation. There's also the potential for a stroke, which is a cerebrovascular accident, or CVA. This occurs when a cranial artery is blocked or bursts. Part of the brain will die due to lack of oxygen, and the symptoms may include numbness of the hands or face, difficulty speaking, inability to see in one eye. All of those are various signs of stroke. An aneurysm, as we have sort of already mentioned earlier, it's a ballooning of a blood vessel. It's most often the abdominal aorta or blood vessels in the brain. Atherosclerosis and hypertension can weaken a blood vessel over time and cause that ballooning. If the major artery ruptures, death can be a result. It can result in uncontrolled internal bleeding, which of course is a very, very dangerous condition. There are a couple of methods for treating these clogged arteries. So a coronary bypass operation, that's when a vein from the leg is taken and used to bypass a clogged artery. There's also gene therapy. This is injection of a gene for vascular endothelial growth factor, which can induce the growth of new blood vessels. Then there wouldn't be a need for bypass surgery because we can simply produce our own blood vessels. Also, angioplasty. This is where a tube is going to be inserted into the clogged artery to insert a stent. Stent is just a small sort of mesh spring that will pop and hold open that blood vessel to allow blood to flow through it more easily. Stents usually are coated in drugs to help dissolve the blockages, so they're not just physical but also chemical protections. Heart failure. Heart failure is the ultimate sort of cardiovascular disorder. This is when the heart no longer pumps properly. There are a lot of different treatments for heart failure, things like wrapping the heart to prevent enlargement, implantable cardioverter defibrillators that can kind of correct an irregular rhythm, injection of stem cells to repair a damaged heart, left ventricular assist device, or an LVAD battery-powered pump that will kind of help the heart to pump properly. Or there is the potential for a total artificial heart. Again, this is only a temporary situation. Really, we need the heart to be able to function and pump on its own for any long-term treatment. All right, so this section was very short. I just want you to list some of those cardiovascular disorders that are common in humans and summarize some of those treatments that are available for those cardiovascular disorders. And also, it's important to kind of cover or look over the section on why CVD is the leading source of death in Western countries, what sort of causes it, and how it can be prevented.